Hello, and welcome to my NURS-FPX 4010 Leadership and Collaboration video. My name is Sierra Gadway, and in this video I will discuss my personal experience of interdisciplinary communication. I will go into depth of how this communication was successful, unsuccessful, and if the desired outcome was achieved. I will be referencing 3 evidence-based journal articles throughout my reflection. In this video, I will also be addressing the following. I will identify how poor collaboration can result in inefficient management of human and financial resources. I will identify best practice leadership strategies from the literature, which would improve an interdisciplinary team's ability to achieve its goals. And lastly, I will identify best practice interdisciplinary collaboration strategies to help a team to achieve its goals and work more effectively together. Before we begin, I want to give you a little background about myself. I am a young, newly graduated nurse from a 2-year associate's program. While I come from a medical background in my family, before I became a nurse, I had no personal experience in the healthcare field. While this allowed me to focus greatly on my nursing education, I was immersed in an entire new world when entering through the hospital doors. I had to develop not only a new skill set, but understand the inner workings of the hospital hierarchy and chain of command. I now work on a telemetry step-down or medical surgical overflow unit. Because of the design of my floor, we became a strict COVID unit during the pandemic. I will begin this reflection by identifying how poor collaboration can result in inefficient management of human and financial resources. I will support this evidence from the literature. When I was hired to be a part of my team, I was told that our nurse-to-patient ratio was 1 nurse to 4 patients. We could flex up to 5 patients depending on staff that day. The COVID-19 pandemic changed everything though. Instead of focusing on cardiac patients, our floor was strictly a sick unit for those so impaired by COVID-19 they required hospitalization. Our single patient rooms quickly doubled from a 15-bed unit to housing a total of 28 patients at a time. Despite this, we were losing staff. On any given day, our ratios doubled with the number of patients on the floor. Instead of the 4 patients I had been promised, I was caring for 6 to 8 patients. We were all drowning and desperately needed help. In New York State, where I practice nursing, all elective surgeries were canceled. This left many pre-operational, circulating, and post-anesthesia nurses without anything to do. Instead of laying off staff, my organization chose to flow RNs and surgical technologists to the floor to help. While this was a great idea, operating room staff and the floor staff, operating room staff and floor staff have 2 very different skill sets. Neither the floor staff nor the operating room staff knew what the floated staff could do to help. The first week they were sent to help, most of the operating room staff walked around lost as to what they should do. This was due to a lack of communication. While in theory this was a good use of human and financial resources, the productivity was lost through poor communication. Some nurses on the floor found it appropriate to hand operating room nurses medications for them to give to the patient. They did this without report as to what was medically going on with the patient. The operating room nurses with the same nursing education had not seen some of the medications that I give on a daily basis in a long time. The operating nurses may have not checked a blood pressure, a level of consciousness, or any other assessment factors regarding the patient before giving the medications. It could not have been expected of them, as it was not their patient to assess. I bring this topic to light as doing this had great potential to cause harm to the patients. Looking to a published journal in 2018 titled Teamwork in Healthcare, Key Discoveries Enabling Higher Quality Care Collaboration, has great potential to benefit staff and clients in the hospital, but poor collaboration and communication can be detrimental to their success. Medical errors are costly for the organization and happen far too often. In total, medical errors cost approximately $21 billion annually. This means that every year, organizations have to pay out for mistakes that could have been avoided. The key to decreasing medical errors is through proper teamwork. For example, a new graduate nurse can be scared to ask questions. By breaking the communication chain, This newly graduated nurse, who may be questioning the proper dosing of a medication, will not look to their charge nurse or the pharmacist for clarification. They will just pass what may be an incorrect medication dosing, an assumption that the provider knows best. For the new graduate nurse, they need to be given the confidence to question any doubt. Research in 2016 titled An Integrative Review of Facilitators and Barriers Influencing Collaboration and Teamwork Between General Practitioners and Nurses Working in General Practice has shown that nursing residency programs give new graduates the confidence in themselves required to ask those difficult questions. When the operating room nurse nurses not knowing how to fix and the floor staff not knowing what can be delegated, both human and financial resources are being wasted. The previously mentioned study points out that there are barriers between different practices despite the fact that we are all nurses. It is the takedown of that barrier we need for proper communication. One example of teamwork the journal uses is through the work of ants. Ants are creatures that when tasked alone to choose a location for the nest have little chance of success as opposed to multiple participants in choosing a nest. Basically, this is a demonstration in nature of how more people working for a common goal is better than just one. Keeping the metaphor of ants in our mind, I want to continue to speak to how leadership strategies can improve an interdisciplinary team's ability to achieve its goals. While we empower our staff for free thinking and fact-checking, a journal published in 2016 titled, Are We at Risk of Groupthink in Our Approach to Teamwork Interventions in Healthcare, states we also need clearly defined roles in our hospital hierarchy. We will do this through shared leadership. Knowing what is within our practice allows for proper flow of teamwork. The problem lies within this daunting hierarchy is empowering those with proper knowledge and when to ask the difficult questions. As previously stated within myself and other new graduate nurses, nursing residency programs are huge successes as to empower the staff in creating reliability in their own role. Ultimately, this journal states that clearly defined roles in interdisciplinary care is the key to proper teamwork and collaboration throughout the hospital setting. With this type of care, all professionals have the main goal to decrease hospital stays and reduce cost. Finally, we ask the question, how do these best practice interdisciplinary collaboration strategies to work together and achieve goals? Bringing everything I have previously stated, shared leadership is proven and evidence-based to achieve teamwork and collaboration. When working towards a shared goal, it is essential that each party clearly knows their roles and feels empowered by each other. Thank you for listening.